But when I was a head and neck surgeon and practicing, I was called on the way to a Dodger game while I was on the freeway by an emergency room to come see a patient in the CCU. She had been having trouble breathing for the last 3 days because they didn't know. But as an ear, nose, and throat expert, they wanted me to make sure that her airway was okay. I went and I looked at her with a telescope through her nose. Sure enough, she had a big abscess infection on her epiglottis, which blocks the airway, and it was a life-threatening. So I immediately called the people I was supposed to meet at Dodger Stadium and said, forget about it, and called the operating room team. We went down to the operating room, and I specifically told the anesthesiologist, do not give her anything that makes her tired. The only thing that's keeping her alive is her effort to breathe, because she's been doing that for the last 3 days. So if you give her anything, she's going to go to sleep. And so, of course, I'm checking the tray with my back to the patient, and I start hearing the alarms going off, and I turn around and she's blue. I said, what'd you do? He said, oh, she was really nervous. I gave her a little something IV. So I grabbed the laryngoscope, looked into her throat. There was a large abscess, couldn't intubate her. So without gloves on, I asked the nurse for a scalpel, did a emergency airway procedure where I slit into her cricothyroid, opened up the airway, stuck the tube in, grabbed the gas, pumped her. She pinked up, she was fine, no residual defects. The whole thing probably took 30 seconds. And I just looked at the anesthesiologist and I said, don't ever do that again.